Hello, every Bendy Body. It's Kate Colbert, your guest host of today's episode of the Bendy Bodies podcast. And this is a really exciting episode. It is are you ready? Episode 100. Oh my gosh. So the Bendy Bodies podcast has been such an important part of advancing understanding of Ehlers-Danlos syndromes and related conditions, and this is huge. So I am here sitting in Dr. Linda Bluestein's regular chair while she sits in the hot seat as the guest, so we can celebrate her and celebrate the success of the Bendy Bodies podcast. So here we are.
Welcome back, every Bendy Body. This is the Bendy Bodies podcast, and I'm your host and founder, Dr. Linda Bluestein, the Hypermobility MD. This is going to be a great episode, so be sure to stick around until the very end so you don't miss any of our special hypermobility hacks. As always, this information is for educational purposes only and is not a substitute for personalized medical advice.
Dr. Bluestein, congratulations, 100 episode. Can you believe it?
No, I can't. It's interesting because in some ways it feels like it should be 500, but in other ways it feels like it should be, 20 or something. So I'm really excited.
You've come a long way. So let's dig into this. So let's celebrate 100 episodes by talking about some things that your listeners might be curious about and talking about sort of where you've been and where you're headed, and maybe dig into some topics that you haven't covered yet in the first 100 episodes. So let's talk about what it's like to be Dr. Bluestein. So let's talk about, I want to know what's the most rewarding part of taking all of your medical expertise and what you've learned over the years and your insights about hypermobility disorders like EDS. What's it been like to take that to the airwaves and to the masses? So what's been the most rewarding part of that?
Definitely feedback from listeners, getting messages, whether it's direct messages on Instagram, messages on X/Twitter, LinkedIn, emails, messages that they leave directly on the website. I mean, that is by far the most rewarding thing. Hearing from people how valuable the information has been, how helpful, how it has changed their life in some way, just means so much to me because it is a labor of love. I don't know that most people realize how much work goes into a podcast. I know before I had one, I was like, oh, it's just people talking. How hard can it be?
How hard can it be?
But you don't realize the planning and the editing and, scheduling the guests and all of the different
relationship management.
Yeah, exactly. All of those things. And then, planning to publish it and the transcripts and the all of that, show notes, et cetera. So I think that, it just makes the work all the worthwhile when I get messages from people that it has really been meaningful for them. It just makes the work meaningful for me. So that is definitely the most valuable for me and the most rewarding part for me. Yeah.
Yeah. It is kind of overwhelming to think about that, in your medical practice, you're seeing one patient at a time, or maybe a family coming in together, but sort of one-to-one sort of medical care. And when you look at the statistics for the show, it must be interesting to be thinking about like, wow, that that one set of comments, that one conversation that we had on that particular date or that particular episode, impacting thousands of people, and what that's like. What is the hardest part? What's been the hardest part, sort of ramping up and doing these sort of first 100 episodes?
Well, of course, there's always a learning curve with everything. So, figuring out the best platform to record on and, how to deliver the information in a meaningful way and what people really want to gain from a podcast and things like that. And who's listening? Who is the real audience? And of course, there's different people in the audience, and I know we're going to talk about that. But I'd say probably what's been really hard is figuring out a way to share information in a way that is both fair and helpful. And what I mean by that is, fair to the listener. So anyone listening to this is unique. Every single person is unique. So when I'm on a one-on-one appointment, right? Like you said, I know I know as much as they're telling me. I know what's going on with that person. I can see them. Yeah. I'm doing a physical exam with them. Like I can deliver the information in a way that is specific to them. With the podcast, that's not the case. I don't know if the person listening is, in bed 20 hours a day and is not able to, be up and moving around because they have such bad CCI or craniocervical instability, or maybe they're not up and moving around because their POTS is so severe.
Yeah.
Or maybe they have MCSF. Like, I don't know what's going on with that person, or maybe they're actually functioning quite well and they're looking for tips so that they, stay functioning well. So each person is so unique, and what applies to one person doesn't apply to the other person. So that's the first thing I find challenging. The second thing I find really, really challenging, and I hope I'm going to explain this well, is offering the correct dose of hope.
Mm.
Because I feel like sometimes when I hear things, everything sounds so perfect and rosy. It's like I just came back from a conference actually where I got to speak to sports medicine physicians about hypermobility, which was an incredible opportunity. And I'm so grateful to Bauerfeind, the founding sponsor of the Bendy Bodies podcast, for sponsoring my presentation, because it was just really great to talk to these sports medicine physicians, a lot of whom were not that, like, they knew about hypermobility, but they didn't realize the multisystemic effects and, how common it is and a lot of things like that. But, when you sit there and listen to a talk, everything sounds great. And it sounds like everything works all the time. And, I would like to say that I have cured every single person I've ever seen. And that's not true. I mean, I would be lying if I said that. I have helped a lot of people. Actually, the word cure, I shouldn't even use at all. I've helped a lot of people. A lot of people have gotten a lot better, but there's some people that I haven't helped. And so while the podcast is a great source of information, and I think it's so important for people to have hope, because there's so many things that they can do. And in many cases, they haven't even tried that many things yet. Yeah. I also want to be responsible. I don't want to let people think that if their doctor hasn't done ABC, like their doctor is wrong or bad or whatever. So I feel like that's hard, balancing that, like it can sound so idealistic or easy to do this particular workup or that particular thing. And thirdly, I want to be fair to the healthcare professionals who themselves are likely struggling in a system that doesn't support them or support them caring for this population that has really complex and time-consuming needs. I have a friend who has EDS. She's a family practice doc, and she had a clinic in a regular, insurance-based practice, and they told her she had to stop taking EDS patients. And I don't know what she's up to now, but she closed her clinic ultimately. So she went from like this practice to, now no practice. At least last I knew, she wasn't practicing. So, it's really, really hard nowadays to be a physician. It's really hard to be a physical therapist. I mean, my physical therapist was telling me yesterday about how she's charting late at night at home, between the regulatory struggles, et cetera. There's a lot of challenges. So it can be easy to make things sound so simple on a podcast. Yeah. And I want to be respectful to all of the different parties and be a problem solver. So that's hard to balance those things.
Wow. It's powerful to hear you talk about that. And as a patient, I thank you for that. I've been listening since the very beginning, and I'm maybe your biggest fan. And though there are a lot of fans out there who probably be willing to fight me for that title. And I think that you're doing a really great job of that. And I think what I hear you saying is that it's not just complex to have EDS, and it's not just complex to treat EDS. It's complex to talk about EDS.
Yes.
Right?
That's a brilliant way to put it. Yes.
And that's exactly what you've done here, is that you have made this commitment to go onto the airwaves over and over again, and invite different types of guests and different types of experts, and various areas of complication of connective tissue disorders, and to have really meaningful conversations and to have relatively in-depth conversations, and yet know that you can't possibly cover it all. Mm-hmm. You can't possibly talk about every type of patient profile or type of story or type of outcome for different kinds of interventions. And so there are going to be moments when patients who are listening, or families who are listening, or healthcare providers who are listening, are going to say that strikes a chord for me, that aligns with my experience. And other times the people are going to say, that's not quite how I experience that symptom, or that's not, that's not how my body reacted to that sort of intervention. And I love your thought around sort of how much hope, what size the dose of hope. And if I can say something, which I think is a sensitive topic, but related to what you're getting at, is we are in a really interesting inflection point in awareness around EDS right now, right? So this episode is being recorded in 2020 at a moment when awareness about EDS is as good as it's ever been, and is still significantly lacking, right? So it's, 5 or 10 years ago, I could mention that I had EDS to somebody, and well, 10 years ago, I wasn't, because I wasn't diagnosed until 5 years ago when I was 45. I'm 50 now. But 5 years ago, could tell somebody I had been diagnosed with EDS, and they had no idea what I was talking about. And now I can, say something, and, the cashier at the grocery store says, oh, my granddaughter has that. Right. And so there's more awareness, more people are getting diagnosed, there's more information out. Social media has been a big help in that. Patients telling their own stories, podcast platforms, and shows like yours have been instrumental to that. And yet, as there is more information available, there will inevitably be more misinformation available. And that's one of the things I really struggle with as not just a patient trying to parse out what could be helpful to me, but as an advocate, as the founder of a nonprofit. So for people who are not familiar with EDS Guardians, I'm the founder and executive director of EDS Guardians, which is a nonprofit that is a patient-to-patient, caregiver-to-caregiver, pay-it-forward organization that helps EDS patients who lack care and need vital support. And I struggle sometimes when I'm trying to find information, because patients will come to us with very unique complications of their illness that maybe I don't relate to personally, because I haven't suffered those issues, and I'm trying to find the right information for them. And there's a lot of information out there that, to your point, simplifies things too much, right? So it's difficult to make a TikTok video about something as complex as gastroparesis or craniocervical instability and sort of explain it in a way that doesn't dumb it down in a way that could be potentially even dangerous. And so I think that is that's challenging. One of the things I appreciate the most, actually, about the Bendy Bodies podcast is that you have not sort of given in to this trend to try to make everything sort of short and punchy and oversimplified, right? So if a conversation with one of your guests, if for them to be able to really sort of explain whatever their area of expertise is as it relates to EDS, requires a 45-minute conversation or an hour and 15-minute conversation, that's what you're going to deliver, right? That you never shortchange the conversation, which I appreciate. And by the way, that's the beauty of a podcast. If you have time to listen to the whole episode, you listen to the whole episode. Or if you're like me, you break it into thirds. So I sometimes will listen to like a third or half of an episode while I'm doing my makeup in the morning, and then I might listen to the other third when I'm out for a walk later that day or before bedtime. I try to do them all in the same day, but break it into little stints. And so it's like going to a conference when I listen to your podcast. So I love that. So thank you. Okay. So we've talked about the rewarding parts and the hard parts and the important parts. I want to come back to something you said a minute ago about that rewarding part, about the listeners who reach out to you. And there's maybe listeners who are listening to this episode who don't realize that how easy you are to reach, and that they can send comments to you through the Bendy website, etc. Tell me a little bit, because I know you get a lot of questions and feedback from people on social media and through the website forums. What are some of your favorite comments and questions that have come in from the Bendy Bodies community so far in the first 100 episodes?
So I'm going to break those into 4 categories. So the first category is patients. Again, when they tell me how helpful it is to hear tips, that, they share with me that they actually bought this brace that they heard about, or they tried this particular, movement pattern, or, they tried again to go to physical therapy, didn't just, give up because they had bad experience, whatever it might be. So when I get those kind of, feedback, and also the validation piece, so many people tell me how validating it is. Like they feel like I'm speaking directly to them. And that's the goal. That is exactly the goal. I try to think of every single one of my patients. And I remember I was at an EDS conference once, the EDS Society conference, and I was talking to I might have been talking actually to Dr. Fraser Henderson, and I was asking him about a couple of my patients, and he was so kind of surprised. And I was like, well, I have a small practice on purpose so that I can know who everyone is. And I'm thinking of these people in the back of my mind when I record an episode, when I plan an episode. I'm thinking of the listeners when I plan and record episodes, et cetera. I've had patients tell me that, I was the first person who ever gave them any kind of a hint about persistent pain, widespread pain, allodynia, which is where things that are normally not painful are painful, that those things could be a sign of hypermobility syndromes, and that they then went and got an evaluation and got a diagnosis. And that if it wasn't for the podcast, they would never have gotten that diagnosis. And so that really means a lot to me, that they're sharing that with me and taking the time to send me a message and say, if it wasn't for you, I would not have gotten a diagnosis. And, kind of like what you had mentioned earlier, I came to the realization towards the end of my anesthesia career that I was taking care of one patient at a time, or if I was working with a nurse anesthetist, maybe a few patients at a time. But I wanted to reach more people. I would go to conferences and I would hear speakers and I would think, there's got to be, as I'm in like the second half of my life and, approaching 60, it's like, okay, I gotta work faster because there's more I have to do before I leave this planet. And so like, I got to figure out a way to reach more people. So definitely, when I get those messages, it's like, okay, good. I'm so glad to know that it's working and that they got to see somebody who made the diagnosis and evaluated them properly. The second category is healthcare professionals. I hear from a ton of physical therapists, physicians, et cetera, that they've gotten information from the show that has helped them take better care of their patients. And I'm thinking of a person in particular. She's a pediatrician, and I don't know why she picked the show to listen to, but she did. And she said she was listening to it and she was like, I wonder if I have EDS. So she pursued the diagnosis and was diagnosed with hypermobile EDS, then realized I have a lot of kids in my practice that are on that hypermobility spectrum. So they might have hypermobile EDS, they might have hypermobility spectrum disorder, they might have something else, but they're hypermobile and or they have unstable joints. This is the category that they belong to, the big bucket. And so that really meant so much to me because, of course, she's expressing gratitude towards me and saying how, it changed her life, but now she's changing other people's lives.
Yeah, that's exponential.
Because she's recognizing it in other people. So when people ask, well, who listens to the podcast? I'm like, it's a lot of different types of people. And I want it to be that way because I want healthcare professionals to listen and feel like they can walk away with something that they can use to help their patients, because that's a way to help even more people. Like you said, exponential. Yeah. And then I get messages from caregivers sometimes that, they can better understand their loved one when they hear things being described. And I've done a lot of episodes that are inspirational episodes that are talking to people with EDS. And, so they hear those stories and they think, oh, okay, maybe the person in my life is not crazy or lazy. These are real things. These are real problems.
Yeah.
And then the fourth category is companies. And I've gotten some lovely, lovely messages from nonprofit organizations. And of course, I love our partnership with EDS Guardians, which is an amazing organization, which I'm so excited about and so excited to see how things evolve there. But I've had nonprofit organizations reach out and want to form partnerships, want to become sponsors, collaborate and things like that, or other companies, companies that have things to sell or whatever. So it's really comes in multiple different forms, but getting all of those messages just, again, makes the work worthwhile.
Wow. I love that. I love that you're hearing from the community, because I'm sure that when you first started that you wonder who's listening, right? Mm-hmm. I mean, so anybody who's ever, worked on the radio or what, you sort of wonder like who's out there, right?
Yeah.
And that's why call-in shows, became so popular on radio. And so I love the fact that that folks are reaching out to you. That story about the pediatrician is really powerful. The exponential effect of every, and I would suspect that every single episode, every single listener, maybe even, learns something that maybe helps them personally or helps one person in their life. But as that, right? So there's that beautiful sort of marketing sort of concept of tell two friends, right? Right.
Mm.
If you enjoyed eating lunch at this cafe, tell two friends, and if they tell two friends and they tell two friends, suddenly you don't have to do any advertising, right? It's the dream. But I feel like that's the case with your podcast as well. I remember listening to an episode really early on, one of your very early episodes when you were doing a lot of focus on dance medicine and dancers and sort of artistic athletes who were hypermobile, and you had somebody on and they were talking about different kinds of sort of pain that happen, and then they're talking about small fiber neuropathy, and there was a description of sort of what that can feel like. And a light bulb went off for me, and it was not a symptom that I have, but it was a symptom that somebody in my family has. And so I was able to pick up the phone to that family member and say, hey, I think that thing you've been describing for years that seems like mysterious and elusive, I think I know what that might be. And this might be something you want to ask your doctor about. And so that's really exciting when you think about how many people are being helped every single day by the podcast. So that's exciting.
And your thought about the light bulb moments is interesting, because I've literally had people say, like, it's so uncanny how the timing of things sometimes.
Yeah.
Like I know this one person was like, I was struggling with this thing, and you had an episode about it. Then I was struggling with this other thing, and then you had an episode about that. And they said, I was almost afraid to tune in the following week because, yeah. So yeah. And it is
That's
true
funny.
that sometimes, that's why I think it's great to address things multiple times or
Yeah.
in different ways, but, because different people will describe things differently.
Yeah.
So what resonates one time doesn't necessarily resonate with another person,
Right.
another time. So it's really helpful to, there's no end to topics, right?
Yeah,
And I love
agree.
getting topic suggestions and, guest suggestions and things like that.
Yeah, I love that. And I actually appreciate that too, that you don't ever think that a topic is sort of one and done on the show, which I really love that. So, as I have begun to get sicker and sicker with my upper cervical instability and sort of headed towards maybe a surgery related to that, I've been able to sort of go back through Bendy Bodies and take a look at, like, where are you talking about craniocervical instability, and where are you talking about non-surgical options, and talking to physical therapists and dentists and talking about the jaw and all these things that are sort of related, as well as talking to neurosurgeons about how this is addressed surgically. And it's really, really helpful to hear you and your guests talking about really important topics from different angles.
Yeah.
And I think that that's really helpful as a listener for me to be able to sort of get all of that. And again, I often liken the show to a medical conference, right? So, I'm a big fan of the Ehlers-Danlos Society global learning conference that they hold every year. This year, 2024, when this is being recorded, they're actually having a thing about CCI, and they're having like 4 or 5 physicians who are all talking about it back to back. Everybody's got 20 minutes and they're talking about different approaches and different insights about it. And I think that, when you bring on all these different guests that will talk about different issues, whether it's joint pain or whatnot, the more we hear about different perspectives, the more we can apply it to our lives. Or if I'm a healthcare professional, the more I can apply it to my patients. And so I do believe that for folks who are listening episode after episode, the learning ends up being sort of that phrase, whatever, the sum is, or the whole is greater than the sum of its parts, kind of a thing. And I do believe that about your show. I love, by the way, that you can go to the Bendy Bodies website and search by topic, or search by name. So you don't, if you're having some brain fog, as is fairly common in this condition, and you heard a little bit of an episode and you want to go back and find it, it's really easy to go to your website and type in the guest name or type in the topic with all those show notes and whatnot, or search by topic in that drop down. And so that's super helpful for folks who maybe suddenly are having trouble with their dysautonomia, that they can come and do a deep dive on dysautonomia and listen to just those episodes this week. And so I find that incredibly helpful. So I thank you for that. We talked a little bit about healthcare professionals, and I know that you recently just had another episode that I got to be on as well, about EDS awareness, where you gave some really great tips to healthcare professionals to sort of increase their awareness about hypermobility conditions. And so, and folks who haven't heard that episode should go back and listen to that one for sure. But what do you wish to, so let's maybe reiterate a little bit of that, or we can address that in a different way. What do you wish all healthcare professionals knew about hypermobility conditions? Or if you'd rather, what do you wish they would do or think differently when it comes? So maybe they're aware about EDS, but maybe the way that their mindset is around these conditions, or the way that they're approaching them is maybe not optimal. So what do you think people wish that healthcare professionals knew or thought or did differently when it comes to EDS?
I really wish that they would realize that people with symptomatic joint hypermobility are actually, most all of them, incredibly heroic. I know it's really hard to understand what it's like to live in an EDS body if you don't have one, but seeing people that keep going, despite having just incredibly crazy and wonky things happen to their bodies that honestly, I think are really hard to fathom sometimes. I think it's just so hard to relate to this. And it's incredibly admirable how people keep going through these things. Severe upper cervical instability, abdominal compression syndromes, POTS, mast cell activation syndrome, spontaneous CSF leaks, headaches that last for years. The things that people are still putting one foot in front of the other, or in some cases, in bed and making it to the bathroom and back or whatever. The things that people deal with on a day-to-day basis is so mind-boggling. And I think that most healthcare professionals, if they haven't lived even a small amount of that, it's just really, really hard for them to relate. I gave a talk a number of years ago, and I came up with this. I sometimes use flip charts when I give talks in person, and I came up with this idea, and I just drew like a line of, if this is your symptom burden, it's going to vary over time, but let's say it's up here. It's like it ranges between 90 and 100, or 80 and 100 most of the time. So you're dealing with, I'm just making the top of the scale 100. So you could be dealing with 50 symptoms or 60 or whatever, which is a ton, by the way. That's a ton of symptoms. But if you're up here at the top of the scale and you're varying like this, and your doctor is, by the way, I'm showing this with my hands, and I mean, not that this is like probably that. Look on YouTube if you really want to see where I'm going with my hands, I guess is what I'm trying to say. And if your doctor has been healthy, like most all of their life, and has always lived down here, zero symptoms, maybe they've gotten the flu and they've barely been a little bit, or, maybe they've been sick with the flu, but then they go right back down, right? It is so hard to bridge that gap. I just feel like that is such a hard thing to do as a patient and as a healthcare professional. I would say that I got a lot of gaslighting before I got diagnosed. And not that I haven't after I got diagnosed, but I got a lot of gaslighting before I got diagnosed. And one person in particular, I knew her fairly well, and she was really super healthy, really athletic, had lived in this body that just performed the way she wanted it to perform. And I think it was just really hard for her to understand a person's body who doesn't. So I think that, if you can even just try for a minute to put yourself in the other person's shoes, in medical school now, sometimes they will do different, more real life scenarios. Well, they'll actually have you wear like a glucose monitor, and they'll have you, pretend like you're a diabetic, and then you have to be checking your insulin and I guess if you're wearing the monitor, but you know what I'm getting at. So, and giving yourself, it's saline shots, of course, but giving yourself the shots. And then they would even do things like lock you out of your car. I mean, I don't know if they actually do that, but maybe they'll send you a text message. You just got locked out of your car. Your insulin is in your car and your blood sugar is 450. What are you going to do?
Oh, wow.
And I think that if somebody can come up with a simulator,
Yeah.
this is a note if you're listening and you have an idea of coming up with some kind of a simulator that you were just walking, minding your own business, and your ankle
Yeah.
dislocated.
Yeah.
And now you've got to pop it back in, or maybe you don't know how to pop it back in, or whatever it might be. But I think that it's just so hard for so many people to relate to these things, and it's hard to wrap your brain around something like spontaneous CSF leak. Like,
Right.
what?
Right.
We're not taught that you can have a spontaneous CSF leak.
Right.
We're just not taught that. So I think that that's where I really wish people would just open their mind, open their hearts, and try to not be like, that can't happen. You
Right.
know, yeah. And for patients to open their minds and their hearts, if you see your doctor Googling Ehlers-Danlos, or they don't know how to pronounce it, which
Yeah.
by the way, I see people complain about that on social media. That doesn't mean they're a bad doctor, and that doesn't mean they're not going to help you. Maybe they actually are going to help you. Maybe they're Googling it because, they're not that familiar, but they're
Right.
going to actually try and learn, and they're going to want to help you. So just like you don't want them to judge you, try not to judge them.
That's great advice. That's a great advice. I love that. And yeah, I think that I don't care how they pronounce it, as long as they're interested. As long as they're interested in helping me. I had a really beautiful moment the other day in physical therapy, and I'm like a lot of us who are, aging and have sort of a cumulative effects on our body of having EDS, even though EDS is not technically a progressive condition, but the injuries can be cumulative for sure. I have a new physical therapist, and she's great, and I'm her first EDS patient.
Oh,
But she was very interested. In fact, when my previous PT was relocating, and I cried when I found out she was leaving, I asked, "So who's going to take care of me now?" And I was allowed to choose a physical therapist from among that practice, and I was able to ask, "Who do you think is really curious? Who do you think is willing to learn? Who do you think won't get overly frustrated if after session they find that they're flaring me because I have, high irritability, or cervical instability, if they feel like they're hurting me more than they're helping me, who's not going to give up on me and who's not going to give up on themselves?" And we were able to identify very quickly a PT who we thought could do that. And she said to me this week, we did one tiny little exercise that flared me, and I ended up with sort of like a neuro crisis, and she knew how to get me through it, and you were icing my head and the whole bit. And afterward, I was so afraid she was going to break up with me, that she was going to do what dozens of
oh,
PTs have done and left me in tears and said, "I just feel like I don't know how to help you. I'm going to go ahead and discharge you," which has happened to me over
oh,
and over again. And by the way, for patients who are listening to this and that has happened to them, that's physical therapy or whatever that modality is that that's the modality or the system failing you. That's not you failing PT. That's not you failing. And that doesn't mean that your condition cannot be
right,
helped. It just
right.
means that the system is sort of not set up to help you, and your provider doesn't feel like they know how to provide different customized extraordinary service for your extraordinary body. And I was so pleased when she said to me, because I was so afraid because I could tell she was feeling defeated, that everything she tries causes a problem, right? I had a hypertensive crisis recently at PT, and my blood pressure went to 230 over 150, right? Like, and this is happening, these things happen. And she said to me, "Kate, it's clear to me that I'm going to have to do a lot more learning,
Oh,
and I'm gonna have to." And she told me about what books she just ordered, including Taming the Zebra, from guests who were recently on your podcast. Um, and what she listens to the Bendy Bodies podcast. I go in every time and I'll say, "I need you to listen to episode 94. I need you to listen to the episode," and I
I
write it down
love
on a
it.
post-it note. And the next time I come in, Jenna has listened to that episode
Wow.
every single time. My previous PT, I sent her something on Instagram once about some really great information. I think it was from something from Jeannie DeBon or somebody. And she said, "Oh, I did a bunch of those courses or whatever when I first started caring for you." And so it's amazing how many of
Wow.
my providers, even without me realizing it, are educating themselves about EDS so they can take better care of me, and hopefully take better care of a lot of other people. And so I
Right.
think that's powerful. And you're absolutely right. Nobody in a body like this expects that our providers have any sense of what it feels like to live in a body like this, which, by the way, I think is, I wish you didn't have EDS because I wish nobody had it. But as your patient, I was blown away when I first was able to get an appointment with you and realized, oh my gosh, this is the first time in my life, and maybe will be the only time in my life that I have a doctor who walks around in a body like mine and who understands when I describe a strange sensation or a symptom or a sign, who might actually know what that feels like. And that is, that's a powerful thing. So let's talk about patients, since I was just talking about being a patient. Let's talk about your patients, your clients. So some of the people who are listening, maybe a lot of people who listen to the podcast, might think of you primarily as, the founder and host of the Bendy Bodies podcast. But of course, your day job is as a physician, right? So where you're treating and advising adults and children, and sometimes entire families, about the clinical management of EDS and related conditions. So let's talk about all of those patients. And I know you have a coaching model where you also coach folks who have such conditions where you're not managing their care as their doctor. In terms of the symptoms or struggles that people are coping with, what are the top three-ish? What are some of the top complaints? Every time I ask you for a number, you always defy me, by the way. Let anybody who's listening, so you all should know this. Every time I ask Dr. Bluestein, give me your top three, she gives me 9, or give me your top,
That's funny.
and whatever she says is always brilliant. And then I think I should have asked for the top 9, right? So
that's funny.
What are some of the, right? you always defy me, Doc. I love it in a good way. What are some of the top complaints that you're hearing from people who are living with you?
That's so funny. Just like how EDS bodies are unpredictable, I'm going to throw a little wrench here and I'm going to give you 3 things.
Oh my God.
I know. So I do pain medicine. So of course, number 1 is pain. And it is shocking to me to see how, I've seen people as young as probably 10. As clients, I'll go, I've seen an 18-month-old, I saw the parents, of course, as a client, which is when I see people online. They don't have to come for an appointment. And like you said, I don't manage their medications. I don't manage their care. I just give them information that's, like a one-on-one conversation and one-on-one customized information. So, but I've seen young people with pain everywhere. And that's really tragic. But, there's people, I can think of this one young man that I saw who was 10 at the time that I saw him. And I'm mentioning him because I saw him such a long time ago. He was one of my first patients very early on, and he had pain everywhere. And mom and dad said, everywhere? And he said, yes, everywhere. And then he thought about him and he said, maybe not my eyelids. Bless his heart,
For me, it's always, if you ask me, where does it not hurt? And I think about it, I've said out loud, maybe the tip of my nose.
Yeah. Wow.
Yeah.
Wow. And with this boy, he's now like 16, 17. And last I talked to mom, because mom's also a patient, as you said, lots of families. He's doing great, living a normal teenage life, and as I mentioned on the last podcast, I definitely have not, healed everyone by any means. I'm not even going to use the word cure, of course, because that's not what we do. We try to improve functional capacity, improve quality of life, make it so that you can do the things that you want to do. But in this person's case, he's doing normal 16, 17-year-old things. He's going to school. Wow. He's, and he still has aches and pains, but he's not in pain like that. It's not pain with a capital P. It's pain with a lowercase p. So that's the first thing. The second thing is fatigue. And there is no question about this. And it is bone searing, cannot get my muscles to cooperate, fatigue, again, I think because I've seen so many people now, it starts to really sink in how bad these symptoms are and how difficult people are experiencing life. And I wish that I did have a magic wand that I could just wave, because that would just be amazing. So I'm working on that also. So fatigue is definitely a huge challenge. And in a lot of cases, they'll have
I have a magic wand right here.
Yay!
So there's a story behind this that I want to share, but for anybody who's watching on YouTube, I actually have a collection of magic wands, and now that I know that Dr. Bluestein needs one, I may be sending her one in the mail.
Yes, I need one. I need one. I will take it to my clinic and I will
You
tap
could be
everyone.
the
Yeah.
magic EDS fairy.
Yes. Oh my gosh, I love that. I have never owned one. I should. Okay, I love that. I cannot tell you how much I love that. That's amazing. So fatigue is a tough symptom. I mean, it is definitely a challenging thing to treat. Not that we don't often, make good strides and really improve that symptom, but that's a tough one. And the third one I would say is gastrointestinal symptoms. So again, it's the whole GI tract from the top to the bottom. So it's difficulty swallowing, frequent heartburn, gastroparesis, which is slow movement, slow emptying through the stomach, SIBO, small intestinal bacterial overgrowth, because things are, not emptying the way they should. Sometimes they get like intermittent partial small bowel obstructions, which cause severe abdominal pain. People get abdominal pain, bloating, food intolerances, diarrhea, constipation, difficulty getting stool out. Could be related to pelvic floor problems, whatever. So, but I would say GI problems are number 3. So,
Wow.
yeah.
Yeah. It's a party. It's just so much fun,
It's
isn't
a
it?
party. Yes, it is such a party.
As Dr. Chip Norris said on the stage at a EDS conference a couple of years ago, he started his talk with, "This disease really sucks."
Ah,
And everyone in the audience just started clapping. It's not what we expected to be his opening remark, and he wasn't wrong.
that's
Yeah,
that's
yeah.
true. That is true.
So let's talk about. So you talked a little bit about a patient who came in with pain everywhere, who was able to really sort of dull that pain through the treatment plan that you were able to offer. So let's talk about things that are working. So we talked about hope, and I think it's really important for folks who are listening. To know that there are a lot of things that are working, that are making people's lives more adapted to this condition, less discomfort. So what's working? So when you think about some of the big success stories among your patients, what interventions seem to have the most promise and why?
So first, I'm going to share my acronym, MENS PMMS, and maybe we'll link another source of information about this. But the letters quickly stand for movement, education, nutrition, sleep, psychosocial modalities, medications, and supplements. So you notice there's 3 M's, and medications is last, because usually by the time people have come to me, they've been on a ton of different medications. And sometimes one of the first things that I do is work on stopping some of those. As the brilliant, I love her so much, as the brilliant Dr. Heather Tick said recently on a podcast interview, I think it was number 95. She said, she asked me, how much did you learn in medical school about stopping medications? And I was like, nothing.
Yeah, I
And she said,
remember
yeah,
that.
remember her saying that? And then
Yeah.
she asked, how much did you learn about starting medications? A lot. So people all the time prescribe medications and never think, what's the end point? And we just keep adding and adding and adding. And there's excipients in those medications, or the quote unquote inactive ingredients, that those of us with mast cells that again, a part of the immune system, white blood cells in the immune system that react to foreign infections and chemicals and things like that. If they get hyperactive, then we want to minimize those excipients. So, that's one thing that I definitely often will do, is start with, okay, let's get rid of some of these medications and supplements, because I think sometimes that can be a huge part of the problem. But I think that the most pivotal thing for me, I'm going to share a story about mast cell directed therapies. So almost exactly 2 years ago, I was asked to give a talk on soft tissue pain and mast cell activation syndrome at a mast cell conference. And I thought about it and I was like, I'm not sure I'm the right person to give this talk. Like, do I know enough about this topic? So I contacted the organizers and I'm like, I'm not sure I'm the right person to do this talk. And they said, you are the most knowledgeable pain medicine physician coming to this talk. And they had already asked me to do another presentation that I had agreed to. And they said, we really think that you're the right person to do this talk. I said, okay, I'll do my best. So I read and read and read and read and read. And as I was reading, the light bulbs were just going off and the fireworks. And I was like,
Yeah.
oh my God. I came across articles like, mast cells, the gatekeepers of pain. What? I was like, wow, I had no idea. Not to that degree anyway. So I started changing the way I treated my patients and started directing my therapies a lot more at mast cell activation syndrome, even if their symptoms weren't 100% consistent. I mean, sometimes someone walks in the room and you're like, oh my God, this is absolutely florid MCAS. And other times it's like, I can make a weaker case for it, but maybe. But I started making more of a shift and, okay, let's identify the triggers. Which is, step one, let's talk about the triggers. It's not necessarily to eliminate everything, but, even simple things like drinking out of stainless steel or glass and avoiding plastic. You and I have talked about plastic,
Yep.
Using air purifiers, avoiding fragrances, off-gassing of things like sofas, getting fresh air. Our buildings are so tightly sealed now. So xenobiotics are a big problem. We're exposed to all of these pesticides, et cetera. So we want to think about those exposures first, and then we want to think about therapies. So in terms of therapies, antihistamines are very, very important. So we have the H1 antihistamines, first generation and second generation. So first generation is things like Benadryl or diphenhydramine, and second generation are the non-sedating antihistamines like cetirizine, fexofenadine, et cetera. And then we have the H2 antihistamines, which are famotidine, otherwise known as Pepcid, cimetidine. I think right now those are the only two available in the US. There was ranitidine, but that got taken off the market. So H1 and H2 antagonists can be very, very helpful. What often happens is people are not taking enough. And again, this is information, not advice. So please consult with your own health. I'm going to give this caveat of consult with your own healthcare practitioner. But oftentimes you have to go a higher dose than over the counter. So I'll give an example. I went on a trip and I got eaten alive by no-see-ums. And I was itching my skin. It was bleeding like for months afterwards. And it was awful. I couldn't sleep. I was so miserable. And even though, obviously at that point I wasn't getting bit anymore, but my mast cells were so activated that I couldn't get them to calm down. I went to the dermatologist and they said, I want you to take Zyrtec and I want you to take 4 times the over-the-counter dose, 2 in the morning, 2 at night. And I was like, what? And that finally worked.
Wow.
So sometimes we have to dose these a little differently, like I said, twice a day instead of once a day. And sometimes it's a matter of finding the right antihistamine. It could be a prescription one, non-prescription one, and trial and error, unfortunately, sometimes is necessary. But those things are really helpful. Cromolyn is another medication that is very, very helpful for the right people. It is a very, very old drug. I say this to patients all the time. I am nearing 60. I'm in my late 50s. And I was prescribed Cromolyn when I was a kid. So that's how old this drug is. I was prescribed Cromolyn for my asthma. So Cromolyn is available as a nebulizer, as a nasal inhaler. You can put it in your eyes and your ears, but that's hard to find actually. You can also take it as a liquid that you put in like a glass of water and you take before you eat meals. Cromolyn helps stabilize mast cells. So it can be very effective, mostly where you locally put it, although I've had plenty of patients say that they've gotten wide systemic effects from the Cromolyn that they're just like ingesting orally. So I've had patients that came on like 8 drugs and they started Cromolyn and they were able to stop a bunch of things.
Wow.
So yeah. So again, nothing works for everyone, but sometimes that works beautifully. And then the last thing I'm going to mention right now is quercetin. It's spelled Quercetin, and that's a supplement that it's a flavonoid, and that can stabilize mast cells, just like there are a ton of things that can activate mast cells. So knowing what these things are and taking a curious mindset is very important. I suffer from anxiety. When we are more anxious, it activates our mast cells, and that makes our symptoms worse. And this is physiologic, by the way. So
Wow.
whatever we can do to try to help our anxiety can also help our mast cells. And that's not to blame anyone. Again, I am definitely, lifelong anxiety sufferer. So it's definitely, though, a tool that we can use that has very little side effects, like thinking about, okay, well, can we do some mindfulness breathing, activating our vagus nerve in some fashion? So other things like that can be really helpful.
That's great. By the way, the activating the vagus nerve, so singing is really great. And
Oh,
if you're not a
yes.
good singer,
Humming,
so
right?
I've humming is really great. In fact, if I have a neuro crisis in PT, my physical therapists know to just get in front of me and they start humming and tell me hum with me, and I'll hum
Mm.
with them, and that can be really helpful. And then singing was kind of an accidental finding for me. I don't, I am a musician, but I can play you a beautiful song on a flute, but you don't want to hear me sing. And so I don't sing for fun, but now I sing for healthcare. So I've noticed
Mm.
that I can be headed somewhere in the car feeling very sick, whether it's my sort of POTS flaring or, sort of MCAS stuff going on. Um, but if I'm listening to music I really love and I'm singing along, by the time I get there, I feel much, much better. And I used to think, oh, that's just, adrenaline or whatever, mind over matter. But over time, I've begun to realize, no, literally, my body is functioning better
Mm.
after I sing. And so that sort of activating sort of vagal tone and whatnot is sort of very interesting stuff. So, yeah, that's great. And I love hearing you say that these sort of mast cell directed therapies are starting to really help patients with a lot of things. I think that when I was first diagnosed, I remember mast cell was sort of the last thing people thought about. It was sort of an afterthought. And now I'm hearing more and more experts saying that they believe that when it comes to sort of the monster that is EDS, that it's possible that MCAS is the head, not the tail.
Oh,
And if
yeah.
we and if we focus on MCAS, that we can then start really sort of seeing systemic improvements everywhere, which is exciting to
Yeah.
think about.
Yeah.
Okay, so let's talk a little bit more about. I want to keep talking about your day job as a doctor. So you're a specialist among specialists, right? So when I explain to people, I always just call you my EDS doctor. And some of my other doctors are like, I don't know what that means. And so I said, well, she's a pain medicine doctor. She's an anesthesiologist by training. She specializes in treating patients with connective tissue disorders. Um, but for a listener who doesn't really know how a quote unquote EDS doctor might work with the rest of their team, like their primary care doctor or their allergist, immunologist, or neurosurgeon or cardiologist or whoever the case may be, can you tell us a little bit about how you fit into the patient's healthcare team, and how you help other doctors do their jobs better by sort of shining the EDS filtered light on the work of caring for those patients?
I would say two major ways. One is as a translator. So, nowadays we are bogged down with so much information, right? And it can be so hard to sort out
Yeah,
hype from, what's actually going to help and interpret
yeah,
this information. So challenging. So I feel like by having somebody that can act as a translator can be really, really helpful. And the other way is by playing detective. A lot of people, they don't have a lot of physicians, I should say, they don't have the time to play detective.
yeah,
So I can often do the groundwork for them, or that's kind of the role I might play on that person's team. And sometimes I've discovered things that have been missed by other people on their team that maybe they would be more likely that they would have caught it, like micronutrient deficiencies, severe anemia, florid inflammation, autoimmune conditions, things that, again, are helpful clues to, well, how can we get this person to feel better? So
yeah,
I feel like by playing detective and by playing interpreter, I can help people get better care, because my goal is to help them get better care from the people that they're seeing, and not seeing me, indefinitely, but being able to work with the other doctors that they have. And also, I guess I should add a third thing, teaching them how to be a better healthcare consumer.
mm,
So, you've mentioned some of the things that you've done. And I think the key there is showing reasonableness. Patients sometimes go into an appointment with a brand new doctor already angry. And
Yeah.
it's, yeah, and it's really, I get it. Like, I understand why, but you also, it's helpful to think about how that person is going to feel from the very beginning, that they can't win, that they can't, there's
Yeah.
nothing that they're going to be able to do that's going to, make you feel like that was a successful encounter. So I think, whenever possible, I try to teach people things like how to communicate better. Like, if they'll say something to me and I say, I think if you're going into another appointment, I would recommend phrasing it like this, because
Yeah.
I want to try to give them a skill set in communication that might help them to get better care. Because I think one of the huge problems that we have is doctors don't understand how patients think, and patients don't understand how doctors think. So I think we need to, your book, Think Like a
Yeah.
Marketer, is a brilliant book. And I, as you know, I have ADHD. I rarely finish a book. I've started a lot of books, but I don't always finish them. But I finished your book. I finished your book.
Thank
It's
you.
a great
That's
book.
great.
So I think, teaching people how that doctor is probably thinking, and this is how you can approach that in a way that's more likely to be successful, I think is the third thing that I try to help people with.
Yeah, I love that. I love that. I will be thinking of you that way now as a translator and a detective. And I love that. And I think you're right. I mean, again, I'm biased. So anybody who sort of knows what I do in my day job, I own a communications consulting company, and so I'm a communicator by trade, and I'm trying to figure out how to help people communicate more effectively. I teach courses on persuasive communications, how to get people to do what you want them to do, right? And at the end of the day, that's kind of the doctor-patient relationship, right? So
Yes.
patients, we
Yes.
want doctors to help us, right? We want them to do what we want them to do for us. And doctors want patients to give them the information they need, answer the questions clearly, help them arrive at a diagnosis and treatment plan, and then be compliant with that treatment plan, and then come back and tell them how it's going so it can be tweaked over time, right? So we have needs of one another. The patient and the provider have needs
Yes.
of one another. And if we can figure out how to communicate more clearly so that we can get each other there, I've had some difficulty in my life getting care where I've had doctors who I thought were providing poor bedside manner in the moment. I've shared a story of being rolled into surgery and having a surgeon who I thought was treating me disrespectfully, sort of in the moment. Um, and I realized this is not in anyone's best interest if I get rolled into an operating room and put under anesthesia while there was this sort of weird tension between me and the doctor. But I was scared and I had a really important question and I needed a modification to my anesthesia protocol that for my health outcomes needed to be addressed in that moment. And I wasn't being listened to. And I said to that doctor, was a neurosurgeon and an anesthesiologist in the room at the time. And I said, hang on a second. I said, last I checked, we were all on Team Kate.
Yeah.
And unless I'm misunderstanding something about the goal that we are trying to accomplish here today with this surgery, I think we all want the same thing. I think we all want good health outcomes for me. And I looked at both doctors in the eyes and then came back to the doctor who was being a little bit fussy and looked him in the eyes and I said, yes. And I waited. And you could literally physically see it register for him and him. And he was just ready to do a really important job as a neurosurgeon, right? Like he was focused on what needed to happen in that operating room. And so he was just not ready for the conversation we were going to have. And I could see him get disarmed. Like I could see him take a deep breath and take a breath and then reach forward. And this is actually sort of related to you. I had a letter from you from one anesthesiologist to another with some information about the protocols that should be altered. And he took the letter back that he had just shoved into my husband's hand. And saying he didn't need to read it. And I know about EDS. And he took it back. And he stood there and he read it. And then he asked a couple of clarifying questions and he turned to the anesthesiologist and asked her a question or two and then said, okay, Kate, I'm going to let you and Dr. So-and-so sort of work out the rest of this and I'll see you in the operating room. And we were able to have that breakthrough and I was able to get the vital care that I needed and I deserved because we communicated our way through that solution.
Yeah.
And in that moment, whether it feels fair or not, It was my job or my opportunity as the patient to broker that conversation for my benefit. And so I think that that's really important for people to understand. I love, and my advice to people would be, we don't in the United States have integrated healthcare in the way that we would like, right? People like to talk about places that places where you've trained, like Mayo Clinic, and wish that we had that everywhere, where, all the different specialists were coming into the room and talking about the one patient case, and it was truly interdisciplinary sort of care. And that unfortunately doesn't really happen anywhere, frankly. But what I'm finding is that I'm the one common, as the patient, I'm the common element of every one of those relationships, right? So I have a cardiologist and my EDS doctor and my primary care doctor and my dermatologist and my whatever. And I can help them. I can help you all talk to each other through me. So you recently said something to me about tell your cardiologist that I have a hunch about this, and ask them what they think about that. Right. And then I often do the same thing with you and with other doctors, where I'll come in and I'll say, okay, so my neurosurgeon, said this really interesting thing. I'm wondering what you think about that. Or he or she had this question for you. And you all have come to a place where you're literally sending me like a carrier pigeon between all of you, right? And I'm delivering these messages. Dr. A is wondering about this, hey, Dr. B, what do you think about that? And suddenly I'm getting better care because I'm helping you all communicate to one another through me, and letting me be that sort of conduit, which I think is really exciting. As close as we might get to interdisciplinary medicine, though I am fortunate to have doctors who actually do sometimes pick up the phone or call each other, which is really great. Okay, so 100 episodes. So let's talk about, as we kind of wrap up this momentous centennial episode, let's talk about a little bit more about the podcast and the future of the podcast. So I know that 100 episodes is a lot, and that I know a lot of podcasters, and I know that the first 100 episodes are the hardest, and that most hosts who make it to this huge milestone become game changers. That 100 episodes quickly become 200 and 300 and 500 and 750, or whatever the case may be. And that when it comes to a podcast like yours, you're not just changing the game. You're bringing medical authorities to the microphone to talk about really consequential issues, and you're talking about the health and the scientific understanding and the medical treatment of EDS. I think that a game-changing podcast like this can inevitably become a life-changing podcast, and even a life-saving podcast, which is a power and a privilege that you carry, and I thank you for that. As you look to the future, what do you hope to accomplish with the Bendy Bodies podcast? What do you and who do you hope to educate and validate, inspire, support through the important work that you're doing here?
Well, that's amazing. First of all, thank you. And I hope to have many, many, many more episodes, because my wish list for topics grows faster than I can record them. I mean, it's funny because people will say, well, what about this? What about this? And I love getting those suggestions, by the way.
Yeah.
But I keep adding them to the list, and it's like, I don't know if I'll ever get to the point where, if I have enough support that I can record and release multiple episodes a week. It's like there's unlimited topics.
Job security.
Yeah, exactly. My biggest goal is to improve care for people living with symptomatic joint hypermobility by educating healthcare professionals and inspiring them to help this population of people who are so deserved of this care and who are living with an unbelievable burden of symptoms that most healthcare professionals just cannot possibly fathom. And I hope to support and just collaborate with nonprofit organizations like EDS Guardians and help them raise more money so that they can work on their mission and their vision and spreading the word about these conditions, because they're so much more common than most people realize and impact so many people's lives. And I said this recently I can't remember if it was at the conference that I was just speaking at, but I feel like this is, I for sure said it at the dinner the night before with the team. I said, this is a public health emergency. I really believe this, by the way. Yeah. I feel like before COVID, Yeah, hypermobility, connective tissue disorders, like this was a problem. But in this, COVID, post COVID, I'm doing air quotes around the
Yeah.
post COVID because, when people still get it, era, this is potentially like pivotal for having enough people to do the jobs to keep society running, because young
Yeah.
people are the ones that are sadly affected the most.
Yeah.
And so we need to be able to identify them, give them the support that they need, help them when they get sick so that their immune system comes back online as quickly as possible, identify immune deficiencies if they have it so that we can support them, through that, and give them the kind of care that they need so that they can have a, meaningful, healthy adulthood, because these conditions affect every single aspect of a person's life, every aspect. It affects their ability to do their job. It affects their ability to do their activities of daily living, their ability to interact with other people in their life and have any kind of quality of life. So, you know, I think that for healthcare professionals to know that this is truly meaningful work, and if you take an interest in taking care of people with symptomatic joint hypermobility, it actually will be really, really rewarding. You just have to start and
Yeah.
just take one step at a time and not get too overwhelmed, and just like figure out, okay, what are some manageable things that I can start doing? Like telling people about the podcast, like that's so easy, right?
Yeah.
And so just start doing those and try to get more information and more knowledge. And just they're doing their best. I really think they are. I really think they're doing their best. You can save a lot of time in the visits by telling them about the podcast, because you can say, go listen to this. Let's do a follow-up in a month or whenever it might be. And, and then let's talk about the remaining questions that you have at that time. So I'm excited about the future, and I hope that we cover lots and lots of additional exciting topics. I hope that there's lots of great research on the horizon to talk about, because I feel like so often I'm saying it depends, it depends, it depends, because we need more data for so many things. But I really think that we are going to get there.
That's great. And, I think the research really is starting to accelerate. I look at, research that's funded, by various sources, whether it's, NIH or, good folks at smaller organizations like the EDS Research Foundation, and, the Ehlers-Danlos Society is funding research these days. And so it's pretty amazing. I can't get over, I actually have a really great article sitting here on my desk that I've been marking up with a highlighter and a pen, that's been really helpful. So there's just more information than there ever has been. It's not enough, but I do think we're headed in the right direction. So as we close, what is your advice for us, Dr. Bluestein, in terms of those of us who are listening? How can we, as patients, caregivers, advocates, medical professionals, how can we do our part to ensure that the world of EDS awareness and care is better? That patients with these conditions are better respected and served by the time that you release episode 200. How can we help?
I think that, like with any community, it's really helpful to represent the community in a good way. So, if you're a bicyclist, it's very important to be respectful of, be in the bike lane, and don't be, you want to represent the community well. So I think when it comes to EDS, like we talked about, like explaining things in a way to really help the healthcare professionals understand you, and helping your caregivers understand you, and asking questions like, what information would help you help me? Ask. If we all listen more, probably that might be helpful.
Yeah.
So I think that's one thing. And bringing up EDS and HSD in conversations is fascinating. Actually, I end up, like, I'll go to a dinner with somebody, and all of a sudden, like I don't know, I'll say some little thing, and next thing I know, they're like, oh, well, I'm double jointed, and I have this and I have that, but they had no clue about EDS or HSD,
Yep.
none whatsoever. And so they're like, what? And they're just, they're starting to really take in that information. So bring it up. You could actually really
Yeah.
bring up this information, and by really seeking to understand what someone else is going through and then sharing your story. I mean, it really helps to share our stories. That really helps a lot. And then lastly, tell people about the podcast, because it's free. First of all, the whole goal is to make this as accessible as possible. So it's on tons and tons of different platforms. There's a lot of different ways, as Kate said, a lot of different ways to get in touch. So please, please, please tell everyone you know about the podcast. Let me know what you like, what you're finding helpful. Let me know what you don't like. If there's things that you're like, no, I didn't think that was good. Or, if you have suggestions for guests, if you have suggestions for topics, those are the things that I think would be really, really helpful.
Wow. Thank you. I mean, that's really great. I love that about the fact that while in many ways the insights that are offered on Bendy Bodies have been made possible by your own connections and all of your colleagues and providers and scientists who have insights about EDS that you have brought to the microphone, but that the podcast itself, I'm guessing, as it has become to this, and
yes,
and listeners are connecting you to different people, and I love that. Ultimately, while this is, I'm so grateful to you, and I know thousands and thousands of us are so grateful to you for doing this important work and carrying this sort of banner forward to have these conversations on the airwave in this way, that in some ways this really has been a community created podcast, because so many people have come to the microphone. So many folks are sending you their advice and tips and saying, here's an idea for a topic for a podcast, and you've been listening. And I love that, that's really, I think, maybe the theme, and maybe we sort of end it there as we celebrating 100 episodes, is that listening to the Bendy Bodies podcast can make a world of difference in individual lives and in this community as a whole. Doctors and providers listening to patients better will enable better outcomes. Patients listening to their providers and scientists and doing their own research and listening to one another will provide for a better experience. Caregivers, everyone in the lives of people who have these conditions, listening and trusting and believing the patients when they tell you what they're going through. We all end up better if we start by just committing to listen. And here we are. And thank you for the opportunity and giving us the chance to listen so far to 100 episodes of the Bendy Bodies podcast. Congratulations so much, Dr. Bluestein. If I had a cupcake, we could celebrate. It would need to be gluten-free cupcake, and maybe vegan and dairy-free, and of course, no artificial colors in that in that frosting, because MCAS. But congratulations.
Which eliminates, of course, a lot of cupcakes out of there. But before we say our final goodbyes here, I feel like it wouldn't be a Bendy Bodies podcast episode without a hypermobility hack.
Oh, yeah.
Yeah, because listeners love the hacks. People love the hacks. They're very important. So, Kate, do you have a hypermobility hack to share with me?
I do. So this one is kind of timely. I've been traveling a lot. So I am a chronically ill entrepreneur, and I've been traveling a lot on business. And so I'm headed to London this weekend, but I just got back from back-to-back trips to Boston, Oakland, Boston. And travel is really, really hard on my body, as it is for a lot of people with any sort of chronic illness, but especially things like EDS. And so one of my big hacks right now is, if I could put it in 2 words, it is pack heavy. So we've been trained, I think, in our lives like that, you should, when you travel, you should, pack light, travel light, right? Right. Travel light. And to the point that we almost feel like that is that's a virtue. People love to brag about I went on a 7-day trip to Europe or whatever else with just a backpack, right? And that somehow that makes them a better person than the person who took a big suitcase.
Right.
But when you have a dynamic disability, you have complex multisystemic illness, you don't know what you're going to need. You don't know what supplements, what medicines, how many pillows, how many neck braces, what other sort of comfort items you're going to need. So pack heavy. So I pack heavy in a couple of big ways. One, I have the Southwest Airlines credit card, because on Southwest Airlines bags fly free. And each bag, your first 2 bags are free, and each bag can weigh 50 pounds. So without spending anything extra, I can take between my carry-ons and my 2 check bags. It is not unusual for me to take 150 pounds worth of luggage on a trip. Okay, which creates its own problems, but I'll get there. So I also take my husband, who is a really great Sherpa, who does not have EDS, so it's he can sort of move these things around. I take everything that I can. I have a luggage, one of those little luggage scales, so I max out if I think, oh, what if I need my knee braces? What if I might need this? What if I pack it, take it. It would be better to have it and not need it than to need it and not have it. And that's my approach to traveling. And then I also, I think that you should be thinking about how to take good care of yourself. So pack heavy and take everything you need, but then also reduce the burden, sort of lighten the load on your own. We always buy the luggage carts, pay for the luggage carts at the airport. So when we park really close, then we go get a cart and we load it up and we go get everything checked in and whatever. And then when we come back, we get a cart. So they're usually like $8 for a luggage cart. You are worth $8. Just trust me on this. And then if it's going to be hard on your body, even if you are ambulatory and you are typically able to walk that sort of a distance, why start a vacation or a business trip with an injury or with extra exhaustion? And so I always ask when I check in my luggage, can I have a wheelchair and have somebody take me to my gate? And so I always travel with a whole bunch of $5 bills so that I can tip my wheelchair attendants, and that can make a world of difference. So pack heavy, but then lighten the burden on your body however you can. So that's my travel hack for patients.
Love it. Yeah, I mean, you're right. But I actually had a pilot say that the other day. He was really a funny pilot, and he said, "I know no one ever likes to listen to the safety information, but it's better to have it and not need it than to need it and not have it." And
Yep.
And people listened that time. Like nobody ever listens to the safety information.
Yeah.
So I think that's a good point. Yeah.
Well, thanks so much for having me on. I love when I get to guest host. It's really cool. And it's just fun to help shine a light back on you after everything that you have done to help patients and to shine lights on your amazing guests. So thanks for the opportunity, and I will let you wrap it up.
Okay. Well, you've been listening to the Bendy Bodies podcast with the Hypermobility MD, and your guest host today was Kate Colbert. And it was so great to chat with you today, Kate. And I hope that we get to chat again for episode 200. And I know we're going to chat again before that, but maybe we'll meet again on episode 200 as well.
Sounds great. Thanks so much.
Okay, thanks. Bye. Thank you for listening to this week's episode of the Bendy Bodies with the Hypermobility MD podcast. Visit our new website at bendybodiespodcast.com, where you can now view guest profiles and show notes with links to products and journal articles. Leave me a comment, sign up for updates, leave a review or a voicemail, and access the podcast on your favorite player, all directly from our website. You may hear your voicemail in a future episode where we answer your question or dive into your gracious feedback. Follow us on Instagram at bendy_bodies. We love seeing your posts and stories, so be a buddy and engage our community by using the hashtag BendyBuddy. That's hashtag BendyBuddy. You can also find me, Dr. Linda Bluestein, on Instagram, Facebook, Twitter, or LinkedIn at HypermobilityMD. Visit hypermobilitymd.com for information about medical services and one-on-one coaching. This podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. Do not disregard or delay obtaining medical advice for any medical condition you have. Opinions shared are that of the guest and do not necessarily represent the views of the host or any particular organization. Sponsorship of the podcast does not necessarily mean an endorsement. Thank you for being a part of our community, and we'll catch you next time on the Bendy Bodies podcast.